On the night of February 19th, actually 12:56 a.m., my husband flung the door open and told me that our son wasn't breathing, and he was 2 months old. He had turned 2 months old the day before.
We started CPR, and the EMTs and local police arrived and continued that out through the driveway into the ambulance and on the way to Health First Homes Regional Medical Center. Doctors, nurses, the entire care team began to work on Patton immediately.
And I remember being folded over in the hallway and nurses just coming up to me and putting their hands on my back. And I remember being embraced, I mean, literally and figuratively. My husband and I, Michael, we had no idea what was going on. But we knew that the work of saving lives was happening behind us.
We didn't have any information as to what had caused it, but the doctor that was on staff took charge of the situation. That was the one thing that caught my eye, to see such organization in the middle of chaos.
He ended up having bacterial meningitis, but he was saved because of the work that was done in the emergency room.
It's amazing to us to see him go from a completely unresponsive state, no respiration and no heartbeat, to this 1-year-old now, perfectly healthy boy that's fun and energetic and developing his personality and developing interests in totally different things than his big brother. For everybody who works at Health First, we thank you. We thank you for the job that you do, and we thank you for our son.
Baby Patton and his family are just a few of the many lives Health First touches each year. As the only not-for-profit integrated delivery network in the county and the second largest employer, we are Brevard's health and wellness solution. A truly local company that continues to reinvest in the community we serve. An organization dedicated to providing the right care at the right place at the right time. Since the opening of our first hospital 77 years ago, we have delivered your babies and taken care of your loved ones in their final hours. Over that time, we have grown into an integrated healthcare delivery network that is striving to be in the top 10% nationally. So whether you are visiting our exceptional providers, training for your first marathon, getting back on the playing field after an injury, or deciding on the right health insurance coverage to protect you and your family, Health First is committed to meeting your needs. You might ask why we do this. It's because we love what we do.
I love what I do because it provides me the opportunity to give back to my community. I have a real sense of pride to Health First Cape Canaveral Hospital. I feel like if I invest in it, I'll leave something for my children and my children's children.
I love what I do because every day I get a chance to make a little bit of a difference in providing care for the patients at the hospital by sending staff to help with those needs.
I love the individuals that I work with because they really, truly are passionate about having positive outcomes for our members.
I love what I do because people come here not wanting to have surgery, and we here in the operating room, we try to make this the best experience that they could get.
I love what I do because I love who I do it for. I do it for a community that has a need.
I love what I do because I get to help people succeed and reach their fitness goals here at Pro Health and Fitness.
I love what I do because I make the patients feel better, make their families feel better. The best part of my day is when I can walk out of a patient's room and know that I made a difference in their life and that they're breathing better and they feel more comfortable.
I love what I do because I've been a patient in the hospital, and from that experience I've learned that being a patient is a stressful experience. In dietary, we try to make them feel like they're in a five-star hotel.
Hi, I'm Steve Johnson, President and CEO of Health First. I love what I do because along with my 8,000 colleagues, I have the privilege to step into the lives of our friends and neighbors, sometimes when facing moments of great uncertainty, such as a disease or an injury, sometimes in moments of great joy, like the birth of a child, and often, and increasingly, to help people keep well. At Health First, we're passionate about what we do every day. We certainly have grown from those early days, but our mission to build a healthier community has not changed. As a fully integrated healthcare delivery network, Health First is uniquely positioned to deliver the right care at the right time and in the right place. Delivering high-quality care is important not only to the well-being of our customers, but also to the economic health of our community. Major companies looking to move to beautiful Brevard are also seeking a vibrant, affordable healthcare system for their employees. A healthy workforce is mission critical for economic success. Being locally owned, not for profit, any surplus stays right here in Brevard. We continually reinvest in our facilities and equipment to ensure we can deliver state-of-the-art healthcare for our customers now and in the future. We also have a strong history of giving back to our community. This year, we plan to invest $60 million in capital improvements alone to ensure that Health First has the facilities, technology, and infrastructure to continue serving you. And whether you want to quit smoking or need to learn how to cope with diabetes, Health First supports programs to help you. In total for 2014, counting all contributions we made to other organizations and our direct charity and uncompensated care, Health First provided more than $119 million of community benefit to Brevard. That support ranges from partnering with the Florida Department of Health, Brevard County, to offer an adult dental clinic for uninsured patients, to screening uninsured residents for Medicaid eligibility through our Medicaid Outreach Education Program. We also teamed up with the area schools to develop the necessary talent and skilled personnel to keep our community well for years to come. We won't stop there. We plan to build on this momentum while delivering the high-quality care and services you have come to expect. And we will continue to care for your family, your friends, and for you.